So this is an overview of what I want to discuss today. I'll start with just a discussion of the obsessive-compulsive spectrum disorders and what the spectrum is. We'll talk about OCD. I'll mention some recommended books and readings on OCD and related problems. We'll talk about causes of OCD. And then the rest of the day will be spent talking about treatments of obsessive-compulsive and disorder and related problems. So I'll start with a discussion of biological treatments, medications, for example, as well as some others. We'll talk about complementary and alternative treatments and what the research says about those. And then the rest of the time will be spent talking about psychological treatments, exposure and ritual prevention, or exposure and response prevention, as it's also called, cognitive strategies, mindfulness and acceptance-based strategies. Talk a bit about OCD in the family, OCD in children, and then a little bit about some other problems that are often associated with OCD or thought to be part of the spectrum. This is a new study from last year on OCD and gray matter. What they found was the severity of aggressive OCD symptoms, are positively correlated with gray matter volumes in the lateral parietal cortex in both hemispheres, and negatively correlated with gray matter volumes in the bilateral insula, the left putamen and the left inferior orbitofrontal cortex. Whereas they found that severity of sexual and religious symptoms are positively correlated with gray matter volumes in the right middle lateral orbitofrontal cortex and the right dorsolateral prefrontal cortex, and negatively correlated with gray matter in the bilateral anterior cingulate cortex. And there was no relation between gray matter volume and contamination and symmetry symptoms. You're not going to be tested on this slide. The reason I'm bringing that up basically is it really suggests that different types of OCD symptoms may be related to different issues in the brain. So just an interesting new finding. The last biological sort of issue I want to share with you is some research on Pandas. So Pandas, these are not the cute cuddly bears from China that eat sticks. Pandas stands for Pediatric Autoimmune Neuropsychiatric Disorders Associated with Streptococcal Infection. It's basically a strep infection, the same infection that causes strep throat. And basically Pandas, it's caused when a child, this only has been shown in children, usually between the ages of 3 and puberty, when the immune system attacks the basal ganglia, this is how it's believed to occur, following a strep infection. It seems to be more common in people who have a genetic predisposition to develop OCD. And basically what happens is this strep infection seems to trigger an OCD-like syndrome in the child. It can also include tics, not necessarily just OCD, and it may not be OCD, it may be just tics in some cases. There's some also recent evidence to suggest that it's not just strep infections. Some other infections may trigger this as well. So sometimes people are just calling it PANS now, Pediatric Acute Onset Neuropsychiatric Syndrome. The diagnostics is controversial. So I've looked through some pediatric journals where there's editorials where they're questioning whether this even exists. It's a very rare kind of syndrome. The vast majority of kids with OCD don't have a strep-related onset. Where you might want to suspect this is if you have an onset that's very, very sudden. So one day the child has no OCD, and then a couple of days later they have full-blown OCD. You may want to get the child tested for a strep infection in those cases. Generally, with any kind of infection, we would use antibiotics to treat it. It's not really known whether antibiotics are a useful treatment for Pandas-related OCD symptoms, though. You might expect that they wouldn't be, because by the time the Pandas kicks in, it's an autoimmune reaction to the infection. So treating the infection may be too late to treat the autoimmune response. So generally, if antibiotics alone doesn't work, or if the OCD symptoms don't go away, at that point, then treatment with medication or cognitive behavioral therapy would be tried. There's very little, because this is so rare, there have not been big studies on the treatment. The best we've been able to find is a case series. So 7 children with OCD that was believed to be strep-related received cognitive behavioral therapy and responded to that cognitive behavioral therapy. So it wasn't a controlled study, it was very small, but some research to suggest that treating the OCD, whether it's a Pandas onset or not, treating the OCD is likely to be useful.